Hi there. Hello. It's 9 a.m. in California. Good morning. Good afternoon or evening to others who are not in the US. Give us another minute to see if we have a few more people who join. I'm just setting up. Let's see if we can share the screen. Great. And anybody in the audience, if you can see the screen, it says Taming the Menopause Monster. If you can give me an indication that you see something, that'd be great. If not, no worries. We'll move forward. All right, one more minute and we'll get started. Thanks for being patient. Let us know if you have any questions in the Q&A. There's an opportunity to ask questions, and I'll try to answer those as we go if I can. We'll start a couple more seconds. Just making sure everything's set up properly on my end. And we'll be recording this. Okay, so let's get started. Hello, welcome everyone. This is Dr. Millen Travarker, nurse practitioner here, based in the US, California, and I am a functional and integrative medicine nurse practitioner. And today we're going to be talking about menopause. It's definitely a topic that's near to me. I'm also in the perimenopausal state, so I identify with a lot of you attending this. And let's see if we can answer some questions. And of course, if you have any questions, put them in the Q&A, and I'd be happy to try to answer them as we go. We're basically talking about menopause and how we address it in functional and integrative medicine. So here are all the things that you think of when you see menopause, right? All these body temperature changes, depression, bloating, irregular periods, lots and lots of symptoms. And I just want to remind everybody that when we're talking about this, this is an educational seminar, and anything here is not intended to provide medical advice. And I always encourage you to talk to your local medical provider if you have any questions, or reach out to me if you have any questions. So, oh my gosh, how many women have menopause? Approximately 50 million women in the US are over 51. That's sort of the age where we see most women become menopausal. And that means about 2 million women in the US are entering menopause annually. And obviously, a lot more around the world. So, what causes menopause? Basically, as you're aging in your late 30s, your ovaries start making less and less hormone, estrogen and progesterone, and these are the hormones that regulate your period or your menstruation, and your fertility declines. In your 40s, your periods might become longer or shorter, depending on heavier or lighter maybe more frequent, maybe less frequent. Just everybody's entering that menopausal stage differently. And usually around the age of 51, on average, of course, some earlier, some later, your ovaries sort of really decline in producing eggs and are no longer sort of providing sufficient hormone for you to go through the menstrual cycle. Some women enter menopause for other reasons. They have surgery or they have chemotherapy and radiation therapy. Some women, we're not sure, they have early menopause due to ovarian insufficiency. This is menopause before the age of 40. And the ovaries stop producing the normal levels of hormone, and therefore they enter menopause early. So again, I was talking about all those wonderful symptoms: irregular periods, dryness, hot flashes. Look at this woman running with this heat, chills, night sweats, sleep problems, mood changes, weight gain, thinning hair, dry skin. Some of the physical features change, loss of breastfulness. And can you imagine, a third of us are going to live our lives in menopause. So obviously, we don't want to be miserable. We need to address this. The more serious issues are the weight gain cause or an instigator for chronic disease, diabetes, hypertension, urinary incontinence. This can be, quite serious for some women. Osteoporosis, and that's where the bones become more fragile, easier to have fractures, and of course put you at huge risk. And then cardiovascular disease. And just the declining estrogen is a risk for cardiovascular disease. Let's talk about something more serious. I think this is something that's not addressed in menopause. The amount of anxiety and depression we're seeing in menopausal women. This graphic shows 1 in 8 women experience depression in their lifetime. That's twice the rate of men. So obviously for menopause, we're going to see some more. About 18% of women in early menopause and 38% of those in late perimenopause experience symptoms of depression. So here we are, those numbers are even higher. We're looking at 1 in 5 or more. And the symptoms of anxiety appear to be more common during this time, and this includes panic attacks. So those women who have a history of mental illness are really at risk and are sensitive to the mood changes due to hormone fluctuations. So I think this is another area that we really need to address in perimenopause. Perimenopause being the time around menopause, and of course menopause is when your periods stop. So let's talk a little bit about sex. This is a state of menopause study, and in this, 61% of women report vaginal dryness that contributes to painful sex. And out of those 61%, 41% of them don't even use lubricants or sex aids. 53% of women are engaging in sexual activity less often because of menopause. And only 4% are reporting more sexual activity. That's why I have Stifler's mom here. This is the movie American Pie, where I think the term MILF came up. And of course, this actress said that she ended up having more sex because of this movie, but that's rare. 50% of women experience physically painful sex with a partner since the onset of menopause. And 55% of those women say dryness is the problem. And then 27% don't even have sex with their partner. So, I think, yes, hot flashes and night sweats, but I think this is another area of real importance to address in our menopausal women group. So let's talk a little bit about what we do in functional medicine and how this helps women in menopause. The functional medicine model is an individualized, patient-centered, science-based approach that empowers patients and practitioners to work together to address the underlying cause of disease and promote optimal wellness. And we are looking at genetics, biochemistry, lifestyle, basically the environment. And we leverage all that data to really give you a personalized treatment plan, and this improves outcomes in the individual patient. So basically, I always joke, you don't have to be miserable. There is a way to take care of all this and heal naturally. It's a whole systems approach, whole person systems approach. We are looking at not just your medical history, not just your surgical history, but we're looking at trauma, abuse, your relationships, your timeline, what's happened to you in the past, how has that affected your health to today. We're looking at mind, body, spirit, and we're looking at lots of therapy options in order to heal the whole person. And that could be acupuncture, craniosacral therapy, Reiki. These are all areas where I refer patients, and we're trying to improve the whole body and the whole person. So when people say to me, "Oh, I'm in menopause, give me hormones," I'm like, you know what? It's not that easy. And you can see by this graphic, your ovaries are connected to your brain, are connected to your thyroid, connected to your adrenal glands, connected to the amount of insulin in your body, which is related to how much carbohydrates you're eating. Your gut, your liver, inflammation, all these areas impact ovarian function. So when people are in perimenopause and menopause, we want to optimize health in many areas, not just hormones. And so this is a really important take-home message for those people who are hitting menopause. I have seen patients who have been in menopause, have been given hormones, and still don't feel better. So there is something more to the picture than just your estrogen, progesterone, and testosterone levels. And what are we looking at in functional medicine? We're looking at genetic information. How are genes being expressed, and how is that affecting health? We're looking at nutrition. Where are the nutritional insufficiencies? We're looking for food sensitivities. Why is the gut responding to some of the typical foods you eat and causing inflammation in the body? We're looking at gastrointestinal function. What's going on with the GI system? Is it absorbing nutrients? And the immune system resides also in the GI system. So is the immune system working properly? Are there toxins and infections in the body, things that are getting also being exacerbated by leaky gut? And leaky gut is intestinal permeability, where basically things that shouldn't be in your bloodstream are getting into your bloodstream through your GI system. And of course, what's happening to our thyroid system, what's happening to our stress levels, which is the adrenal glands causing cortisol levels to rise, and how is that impacting hormones? And we know stress is a huge factor for hormonal imbalances. And cortisol rises, it actually steals your other hormones in order to to deal with the stress. So I created this really complicated slide. It has a lot of information on it. But what I want to go over is sort of all the different things that we can do to improve women's health during menopause. And in functional medicine testing, we're looking for nutrition depletion, some of the root cause analysis that I talked about, and we're using herbs and supplements to rebalance the body. We're also doing a guided detox, and I think in the detox, what we're doing is removing toxins and endocrine disruptors, which impact also hormonal function. Vitamins are essential, and these are some of the vitamins I use. I use B complex, vitamin D, vitamin C, magnesium, fish oil, probiotics, and fiber. And those aren't vitamins, but basically supplements. Herbs for hot flashes include black cohosh, Siberian rhubarb, red clover, sage. Soy can be really powerful to helping with hot flashes. Supplements I use for balancing estrogen is DIM, I3C, and calcium D-glucarate. Again, I think these supplements need to be sort of ordered in conjunction with testing to understand if you really need them or not. And I'm going to talk about the Dutch test as a powerful way to do that. Um, Herbs for increasing progesterone, Vitex. Herbs for improving inflammation in the immune system, curcumin, melatonin, resveratrol, quercetin. And then sugar imbalance is a huge issue for a lot of menopausal women. So I've listed some of my favorite balancing herbs, including cinnamon, fenugreek, chromium supplements, myoinositol. And again, this isn't go and pick it up off the shelf and use it. I think working with someone to really understand which herbs and supplements are going to help you and what's happening in your body chemistry is really important. Another intervention we use is food as medicine. We know that food has all the important nutrients that we need in our body for it to function properly. And if you're not eating a wide variety of these types of foods, you're going to have issues. You're going to have health issues. So, cruciferous vegetables are really important. Um, Fresh greens and vegetables, lots of different colors of the rainbow. Berries are really wonderful antioxidants. Melons, citrus, legumes, soy, beans, raw seeds and nuts, whole grains, oils, flaxseed, olive, sesame, and green tea is excellent for menopausal women. And of course, I always tell people to do decaf because sometimes the caffeine can affect you. So I want to talk a little bit about the Dutch test, and this is the test that I use during menopause to help women understand their hormones and how they're being metabolized. And there's a version of the Dutch test that actually does urine samples throughout the month so you know what's happening to your hormones throughout the month. The Dutch test, this is a little example of the Dutch test. This It's a little complicated to understand, but it basically shows how your hormones are being metabolized at different points in the all these steroid hormones kind of move into each other, and you have different enzymes that help steroid hormones move through pathways. But you see the testosterone, the estrogen, the progesterone, and then we look at the metabolites from estrogen and how it's being processed and what your risks might be for DNA damage or hormonal imbalances, why you're feeling the way you do. And it really is a great test for those of us in functional medicine to really give tailored advice on herbs and supplements. I want to talk a little bit about the North American Menopause Society, or at least those of us in the US. We have the society that's given us some position statement this year. And, I think there's a lot of, um, controversy on, how to treat menopausal women. And so NAMS has reviewed the data and they found that hormone therapy is effective for vasomotor symptoms and the genitourinary urinary syndrome of menopause. And it's, of course, shown to prevent bone loss and fracture. And so I wanted to throw this out there because I think a lot of people are really worried about hormone therapy and its effect on health and what's the right choice. And of course, I'm going to tell you the right choice is different for every person. So talking about a little bit about hormone therapy, we know that hormone therapy is best for those who are around 50 to 59 within 10 years of menopause, and this improves your cardiovascular risk. And in 2017, there was some data from the US and Europe that concluded the use of estradiol-based hormone therapy is not associated with cardiovascular risk, but rather reduce the prevalence of coronary artery disease. Again, there was a lot of, controversy has been for the last 20 years, especially since I've been in practice, over whether hormone therapy is safe or not. And I think the data is showing that it is safe, and we have been given some guidelines about when to initiate hormone therapy. As far as osteoporosis, menopause hormone therapy is effective, especially estrogen is effective for the prevention of osteoporosis and increases bone mineral density. There was a basically a big study of 57 studies that showed that women had a change in bone density that is significantly higher in the hormone group um, at all sites, at all the hip and all spine, all the different sites that they check osteoporosis in. So estrogen is the best therapy for us for osteoporosis. Another area of controversy is how hormone therapy helps with cognition, or, a lot of menopausal women will come to me saying they have brain fog. And the lack of estrogen is a main contributor. There's sort of a controversy of whether it is a main contributor to age-related learning and memory loss, and we don't really fully know. But I do want to say that we know that estradiol works on the nervous system at many, many different areas, and I've listed this here: neural function, the cerebral cortex, basal, forebrain, hippocampus, and striatum. And there are estrogen receptors in those areas. And so, my theory is that estrogen is going to be important for cognition. So, the Women's Health Initiative was one of the studies in the US that gave menopause hormone therapy a bad name. And I know many of us, especially I was trained about 25 years ago. And when it was published, we were all sort of taught that giving hormone therapy was bad. But since then, a lot of studies have shown there are benefits to hormone therapy. And I think specifically for the bioidentical hormones, and bioidentical doesn't mean that it's still synthetic, but it's exactly like the hormones in our body, and that's estradiol and progesterone. And a lot of the Women's Health Initiative studies were based on equine estrogen and progestin, other progestins, not progesterone. So my theory is every woman should be treated as an individual and needs to be having a detailed conversation with her provider on what is the best decision based on her health history for taking hormones or not. And it's a complicated issue. I think it's not the same for everybody. I do think there are a lot of people who'd benefit for bioidentical hormones. Again, it needs to be a nuanced conversation with your provider. So I wanted to give some resources, and you can take a picture of this or, save it for you to kind of reference all the different areas. I am not only addressing women's health from menopause, fertility, but also sexual function. We want people to feel good all around their lives. It's not just hot flashes and night sweats. I mean, I think the sexual function piece is really important for menopausal women as well. Here are some resources for you if you have any questions. Of course, I always ask people to reach out if you need any help. We're here for you. I'm based in California, but I am seeing people all around the world and helping anybody and everyone, specifically in women's health. But I do see some other clients as well for functional medicine. I see men as well. I see men and women for sexuality and fertility. Please reach out if you have any questions. Where our phone number and email are listed, and we're all on all the social media at Lotus IHN. It was my pleasure to present some of this information really quickly about menopause. It isn't, of course, a very in-depth presentation, but it gives you a little overview of menopause, a little overview of what we do in functional medicine, and of course, a little bit about the controversy around hormone therapy. Again, I just encourage people to go out and talk to your provider about this. If you're feeling miserable, there's no reason to feel miserable. That's my goal in life, to make sure women don't feel miserable. We shouldn't be. We should be feeling like, we should be feeling 100%, if not 150% as we age. And it's really important to get the help that you need for any of the symptoms that you're experiencing or any of the disease states you're having. So thank you for letting me present this information. If there's any questions, I'll take them. I don't see any questions. I'll give 1 or 2 minutes for any questions. I don't see anything. Okay, I don't see any questions, so I'm going to go ahead and end the presentation. Thank you for attending. So good to see you here, and we look forward to seeing you here in the future. And we will be presenting some kind of webinar topic every month. I also do an Instagram live every Wednesday at noon Pacific Standard Time, so please feel free to join if you want to hear about whatever topic we're talking about. And we will be posting all that information on the social media on Instagram and Facebook. All right, take care. Have a wonderful day. It was so nice to see you here, and I look forward to meeting you soon. Take care. Bye.